Hi guys, and welcome back to our 5th video in our series. Today we're going to be talking about cardiac arrest and the management of a cardiac arrest patient. So in Ireland every day there's average of 13 to 20 people drop dead suddenly every day. So a lot of people get mixed up with a heart attack versus a cardiac arrest. So if you look back on our 3rd video, we talk about heart attack there and how to manage it. In this particular video today we're going straight into our scenario. Yeah, Kaveen, will you fire up the mixer there and get the spirit level as well, and we'll get this squared up.
Yeah.
We might have a bit of time there to go along and get it done this evening. What time is Mammy home from town?
7 o'clock.
7, right. Okay. Yeah, I must make a couple of halves there. That's a while since I broke a few blocks. Did you get the clouds out of the boot? You did?
I did.
Right, okay. Oh.
Are you okay?
Yeah, I'm going grand. I just probably pulled the arm there or something bit.
Are you sure?
Yeah, I got a bit of sweat. I think I had a bit of a bug, stomach bug. That bug is going around the sweating med. They had last 20 minutes or so. Oh.
I think I should call an ambulance for
you.
you.
Stop, will you? You're watching that baldy fella, the goatee on YouTube again. Will you stop living? No, I'm absolutely fine now. I'll be grand in a minute. Did you run out the power to the mixer there? You didn't fill the barrel? Yeah.
I think I should call an ambulance. You're not looking good.
No, I'll be absolutely fine. I'll be fine.
Oh. Dad?
Oh, yeah? I'll be okay. I'm just sitting down for a minute.
Dad? Hello, can you hear me? Aoife, call an ambulance. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
So here you've seen a scenario where a gentleman at home suddenly became unwell, dropped down, and luckily enough his son was on scene to do CPR. As you noticed there, what the son did is he came in, called for help, seeing safety, looked around, opened the airway and began chest compressions. So the thing about it is about an average about 70% of people drop dead at home, and that's correct, at home in the home environment. From my point of view in the ambulance service as well, we normally do cardiac arrests in the home. When dealing with a cardiac arrest at home, it can be very traumatic. We need to be thinking about CISM, which is Critical Incident Stress Management. After a cardiac arrest of a loved one at home, you need to talk to an expert. Talk to your local GP, talk to your local nurse. If you know a paramedic, by all means talk to them, or somebody that has done CPR. Be very careful of the second-hand information that's given out there. Over the years, that thousands of classes I've done, is that I've often met people who have done CPR for real, and a lot of people have been left traumatized because they think, oh my God, I did CPR, I didn't do it right, my loved one is gone because I didn't do it right. That's not the case. So what you need to be doing is talking to an expert at that moment in time. Remember, we have a 7% survival rate currently at the moment in Ireland, and we have the highest rate in the world for bystander CPR, which is great. Another thing too as well, as I talked about in our second last video, about our community first responders. They're all over the country, guys. Okay, so let's learn how to do CPR. Well, CPR is quite simple to do. It can be a bit physical, but let's keep it simple. So what we're looking at here is we have a patient on the ground. We're going to find the line between the two nipples. We're going to put our left or right hand in. It really doesn't matter. Keep your knees back from the patient. What we're going to do is put the heel of our hands here, lean in over the patient, and we're going to start off with our chest compressions as you saw earlier on in the video. 1, 2, 3, 4, 5, 6, 7, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 25, 26, 27, 28, 29, 30. So as a result of that there, I was going to keep going indefinitely till such time as the ambulance arrives. So another thing you're looking for then in your local areas then is maybe a defibrillator. So this is only a trainer defibrillator, but so that's why you'd be keeping an eye out for the local one in your local parish. So normally what happens here then is the defibrillators look something like this. There's normally 3 steps, 1, 2 and a 3. So the first thing you're always going to do is turn on the machine.
Apply pads to patient's bare chest.
So I would recommend highly that you go off and do a defibrillator course as well, because it's great practice and a great ease of mind from doing it as well. So here on the defibrillator pad you can see which side that you're going to put your pads on. So this one would go down here on the right hand side, like this. This one up here would go up down on, sorry I said the right, I meant the left hand side. This one go up on the right hand side.
Plug-in connector.
And as soon as
Analyzing heart rhythm.
Analysing heart rhythm. Stay away from the patient.
Do not touch the patient.
Do not touch the patient.
Shock advised.
Shock advised. So if you notice what I'm doing is I'm repeating. So the machine is charging currently at the moment.
Stay clear of the patient.
Stay clear of the patient, making sure everyone stays clear.
Deliver shock now.
So the next thing anybody can see
Press
the button flashing.
button.
I will
Shock
press the button
delivered.
and off I go back into the chest again.
Start CPR.
And I keep going indefinitely. So at this moment in time I'd be shouting out help, is if there's a loved one around they can actually come out and give me a hand. So quick recap as well, yet again, when I come into the patient, the first thing I'm going to do is see in safety. I'm going to shake and shout like I did in the scenario earlier on. I'm going to open the airway and look for signs of life. For this particular case, we don't check a pulse. What we're also doing then is we're looking, there's no signs of life. We've called the ambulance and we're going to do chest compressions only. So the 16th of October this year is the World Restart the Heart Day. So in your local community, which will be happening on Saturday of this year, if you're around, you see them doing demonstrations, please go over and talk to them. It's not about collecting money, but it's about getting information. So if you've never done CPR before on a mannequin or anything of that nature, please go along and have a practice with it. So let's recap. So tonight we learned about CPR. We learned about the signs and symptoms of what can happen slightly before going into a cardiac arrest. Remember, check out our third video on chest pains and how to deal with them at home. We followed on then, a patient collapsed on the ground. Next thing we did was see in safety, come in, shake and shout, open the airway, call for help, start CPR, most important. So yet again, when we did our practice session with our mannequin here on the ground and we used our AED, I would highly recommend that you do a local AED course. So here in Ireland we do them under the Irish Heart Foundation and also as well under the Pre-Hospital Emergency Care Council. They've been run virtually every day of the week in Ireland. Look out in your local area because they are the course that's going to save your life. Going back on some of my other videos, it's remember it's you who'll save the life. You're the person that's going to ring for that ambulance, get the ambulance out, and that's the person that's going to save the life. Thanks again, yet again, for your ongoing support. If you like us, give us a like and a subscribe as well. Our video next week is on choking, dealing with an adult patient, some of the issues that are around it. So look forward to seeing you again next week.